Ready?
Yeah.
Ready?
I think so.
Okay, let's start. Hi everyone, welcome to Therapy Outside Therapy. So this round will be a lot of interesting aspect to address to help you to get to know us a little bit more. So today we have a little bit more heavy question, to be honest. The question we're going to address today is, do therapists experience challenges in session? Okay, so a lot of people have this thought that because we're a therapist, we're so well trained, we see so many people, so we are so capable in managing difficulty. So find out more from us today, from the sharing from all the therapists today. So I'm Nicole here, digital counsellors, specializing in marriage and family therapy.
Hi, I'm Celeste. I'm a registered clinical psychologist. I'm also working with Dr. Nicole over here. And then I'll
Pass it to me? Okay. I'm working under Dr. Nicole. I'm a training counselor at Hughes Systemic Therapy. Yeah,
Yes.
hopefully.
Yeah, we are all from Hughes Systemic Therapy. Yeah, thank you so much being part of today, session with us. Okay, so I think addressing this question, do therapists experience challenges in the session? Okay, so who would like to take up this challenge? So I think first thing that we wanted to address often is therapist self-doubt. Do we doubt ourselves as a therapist in this session? Who would like to answer this
rock,
question?
paper, scissors.
Oh,
Okay,
okay.
gentlemen start first.
Oh, okay.
Oh, you want to try?
Go
Can.
ahead.
Okay, gentlemen,
Yeah,
start
let's
first. My answer will be yes, a million times yes, that I think therapists are okay. I think almost all therapists will have at least once in their career to experience a bit of self-doubt. But especially for me, who have just been doing therapies work for about a year plus, I think I experienced it a lot, especially in the first 3 months of my practicum experience. It's a very constant thought that I always have is, am I saying the right thing? Am I doing the right thing? Am I even qualified to hear about all of this experience from the client? And even if I hear it, am I able to say the right thing to be able to help all the clients? But I think with experience, it does help me to grow more confident. But I still think that the self-doubt is going to be here for quite some time. So maybe I can throw the question back. Will the self-doubt actually ever go away?
That's a very interesting question.
Yeah.
Like hearing your sharing from there, right? I would say like the self-doubt changed over time.
Huh?
Yeah, so of course, especially under practicum training, right?
Yeah.
I probably was trying my best, especially working in the university counseling center. Like there's no option to choose what you're comfortable with yet. Right? So you get a variety of cases, and it's a lot of, I guess, just trying my best at that moment, right? And the self-doubt changed after I became, in this case, practicing outside on my own, right? After graduation, the self-doubt is like, do I deserve so much money paid out for the session? Because as a trainee, it's about, what, 30 to 50 ringgit, right? So once I graduated, it's like, how do I justify? Do I offer more value? But that doesn't work as well because I already tried my best under practicum, right? So yeah, and then now after 5-6 years of working as a therapist, I would say the self-doubt comes in the sense more on, especially with new areas that I have tried to look into. So for example, family and couples therapy is very new for me. Right? So I remember the first family client I got, and it was very, very interesting from that. Because I feel like it's my own competency, for example, right? Able to handle the session well or not. So I remember that session went on for much longer. Yeah. So I guess the self-doubt would change, but I feel like ultimately the trust in our training, right? The trust in peers, especially, like peer support is so important. And yeah, so trust in the client as well, I feel like.
Yeah, thanks for sharing. Definitely, I do agree because after experiences, with different client, different exposure, it does help to kind of like provide a little bit more confidence. So therefore, the self-doubt will become lesser. But the good news to share with you, I'm practicing more than 24 years.
Okay.
I still have self-doubt too.
Oh, is that good news?
I would say, I guess it depends how you see it, because
Okay.
a lot of people may, how can after you practice
Yeah.
more than 20 years, you still got self-doubt?
Yep.
Yes, because it depends the cases we're dealing with. Sometimes cases can be so complex. There's so much thing to consider, so much factor to be part of the assessment, the part of the intervention. So I do say yes. Come to this today, I still feel at the time that I do face challenges in dealing with certain cases, and that kind of like causes me feeling, are you capable to do this case? Are you sure you can do this? Maybe you should refrain out. So I'm assuming yes, that sometimes does not come out as well. So I would say that what you feel is normal, and I agree with you. It takes time to feel a little bit more better. But yes, it's part of our journey as a therapist, and I think that another perspective is self-doubt is also kind of pushing us to able to do something more, to able to increasing our competency, increasing our skill set. As such, we do pay a lot of money, investing a lot of time for training and supervisions, and all this is a lot of cost. But it's part of our journey as a therapist. Yeah, so yes, this is what we want to share.
Yeah.
Anything come to your mind?
Oh, I'm just thinking, because since right now a very big difference in experience, 24 years, me just 1 year, right? And in that case, there's still a lot of things for me to learn, still a lot of things a lot of skills for me and experience for me to learn and all of that, right? I'm just thinking, if is that the case, right? There's always this bugging thought, especially in a session, right? Am I qualified enough, to handle this person's emotion, to handle this person's experience, to even hear about their life? What makes me so special? Yeah.
Okay, yeah, it's true. Sometimes it kind of like start questioning us in terms of, do we qualify to see client? Yeah, and I cannot deny that sometimes clients do kind of like making choices based on the experiences, the training we have. So maybe I'd like to hear from Celeste's perspective regard to what what I want to share with us just now.
I think let's reflecting on what you guys were sharing as well, right? I remember one of my supervisors in the past as well. What she mentioned is the learning process is two-way. So as much as when the client seeks help, right, we are there. And when we listen to the story, sometimes it's already providing a lot of grounding and all that. That's what we believe in as well. And in this case, we do learn from the client, I feel like. As with each client that I've seen, I feel like my way has changed since I first started practicing as well, like how I would have done it. Yeah, so I think both sides provides meaningful experience.
Yeah, I think we focus so much on you. How about us? Like talk about your feeling, your experience, in terms of you have came across this self-doubt experience. I think that we're able to help us normally make sense, and it's our audience to be able to make sense. Yeah. Yes, go ahead.
Self-doubt. So I guess like one of the cases I share is when I first have my big family client, right? So there's a huge moment of self-doubt, and I would definitely reflect where self-doubt is a point of learning. So one of the experience I've got is I've been receiving more and more trauma-related cases as well. So which is also what prompted me to also once again sign up for another workshop, I would say, right? To learn practical skills on how to assist, right? So definitely we already would have some grounds in terms of what to do, but lifelong learning wise, I feel like that helps addresses the self-doubt. So self-doubt comes in different forms. So I wouldn't be able to tell like what special challenge this next client might bring. Keeping that aware that self-doubt can occur anytime during the session, and then having this awareness internally, right? And then seek maybe a peer supervision, peer consultation, let's just say when opportunity comes around, appropriate training comes around, then that helps with addressing the self-doubt and growth along the way as well.
Yeah, maybe for the audience sakes, just get us to able to explain to you what is peer support. So what we do in helping profession, sometimes it's not easy to get an expert, to able to guide us accordingly. Sometimes we need immediate response and perspective, and therefore we gather a group of peers who are well trained in the field, especially in the area we are specialized in, and we discuss about the case together. And of course, you requested, oh no, do we let our therapist share the cases with our peer? Yes, we do, but we make sure that your name are protected, client name are protected. We basically wanted to get perspective from another therapist, because all the intention is basically to help our client. So therefore, we don't limit into just only the set training we receive or the experience we have, but we have different peers who are also very good in the field to able to share their perspective. Therefore, we wanted to able to facilitate that. It's also quite a common practice among mental health professionals, because it is not cheap, to be honest with you, to basically engaging supervisors overseas. Be honest, I don't know how much money I spent for training and supervision. I don't want to reveal here. It'll be shock a lot of people. But yes, it's a part and parcel of our journey to becoming a mental health professional. So I see, self-doubt in contact here actually can be like a motivation for us to keep improving rather than keep feeling. So that's how I feel. So that's the reason why I end up spend a lot of money, time, effort to attend law training. And I think that in my start journey is also kind of like figuring out myself as a therapist. I remember last episode I talked about how each therapist somehow find their way to able to come up, with their approach that able to fit well to a certain group of clients, and certain clients will look for the therapist. The same here, that we are spending a lot of money, time, wanted to do the best for you as a client. All right. Okay, come on, self-doubt. Just now talk a lot about competency, right? So let's talk about something a little bit more personal. Emotion trigger. Sometimes we may face cases that really questions. It's not just about competency aspect, but it's also a lot of emotions that within us. So we also want to take opportunity to share with you. So we do came across that experience. But maybe I would like to hear from different therapists to share that experience with you. How we're managing it. Yes.
I first, okay. I think for me, I don't know, fortunately or unfortunately, I did not have that many experiences or many sessions where my emotional was quite triggered. Oh, it's a good thing, okay. But there is a few times that it happened and it stayed with me. But until now, I think it's still once in a while driving, it just occur in my mind, like an intrusive thought, something like that. And for me, at that time, right, when I first experienced that emotional trigger, I remember thinking to myself, I need to stay grounded, I cannot go there now. So I activated my other brain to try and stay grounded. So I did a little bit of trick there. It's like 5, 4, 3, 2, 1, but I skip a lot. I just only do one, which is just to focus on one of my senses, which is like planting my foot on the ground. Make sure that I'm still in the session, I'm still with the client. So whatever I have, the emotions that I have, I can process it by myself later. But I think from the training that I received also, I know that sometimes this emotional trigger can be quite therapeutic also for the client if we share like similar experience. So to sort of show support, right? And show them that, you're not alone. We have this same kind of feeling, same kind of experience. But I don't. For me, actually, I'm brave enough to say that I'm still a coward in expressing those yet within the session with the client. I'm not there yet.
Wow, that's interesting way to describe it, but very what is called say appreciate that your openness and very transparent in how you feel about it. Sometimes yes, we do face this. Maybe I would say after that I'll come back to you, right? So yes, sometimes we can have this emotional trigger. But I think like what Waiwa said, that there's two aspects. So one aspect is like, okay, what happened to me, why suddenly this emotion being triggered in this case. Especially for me, because I specialize into couples and family work. So I do see a lot of couples and family. And something very close to my heart too. Family is always close to my heart, relations close to my heart. So it's such that sometimes whatever that presented by the client sometimes can be very emotional, overwhelming. And that will also bring me back to how I feel about myself and my family too. Yeah, so example, very simple. If a client say that, oh, I'm not doing enough as a mom. And I have this question, Nicole, are you doing enough as a mom? That's how can be quite triggering, challenging to face it, but it's also part of the journey of us as a therapist to come dealing with that. So therefore, sometimes I felt like this emotion trigger, it may be perceived very negatively, but actually, in another perspective, it ground me and remind me, hey, yeah, you're not just a therapist, you're also a mom, you're also a wife, you're a daughter-in-law, you're also a daughter. So I felt, yes, I do agree with you, sometimes this emotion trigger, it does remind us we are not limited to just a therapist, we're also a human being, and we have different role to play with. And can be challenging trying to place all different roles, just like you too. Okay.
A new role, YouTuber.
Okay. Yeah, this is, I just want to share that the kind of like some of the part of my experience. How about you, Celeste?
I definitely resonate so much with the when you talk about being human. And I feel like when, as a therapist, our emotions are triggered, right? It means that you are talking to a human, right? And this is a frustrating human experience. This is a sad human experience. So in this case, it does. I really don't know. I feel like in this case, it's really in the moment with the client in the room. Usually, it's a very small room, right?
Yeah.
That kind of space that we share with the client at that moment, that might be what is powerful as well. As I remember a few times, just looking back, right, there were times that, it depends on which emotion, right? There were times where I did get quite teary with a client as well, a few occasions. And I feel like in those moments, sometimes words are not what's happening, although we do talk therapy, right? So in those moments, words are not what's the most important. So it depends how I deal with it. So with very strong emotions like sadness and all that, we let it hold, we let it sit in the room, right? But with frustrations, what do you think? When there's frustrations, I feel like it's quite different.
I like what you said. In other words, it's about sharing the human experience, right? But sometimes it's the human connection that precedes all of our skills, that precedes all of our interventions and things like that.
Yeah, just now, when you talk about that get very emotional, right? Together with our client, I experience the same too. So I think this aspect we also call like holding the space, for the client. I think the art of the therapist is how we hold the space for our client, at the same time for ourselves when we get very emotional triggers as well. So that aspect is something that personal levels as a therapist, I do find that it's something very honored to be able to hold a space for our client. And yes, I do get very emotional as well. I do tear together with my client because sometimes you can be very touched by their word, and you can feel so much of their pain. So we are just human, so we do feel. And I also want to assure you, when your therapist tear together with you, does not mean that, oh no, something wrong with the therapist. But I felt it is like this space that the therapist together with you are holding it together to hope to be able to honor your time and your sharing. So we wanted to able to hold that space. That's why we call holding the space. All right. Thank you so much for both your sharing. So let's talk about moving on to the next aspect. There's a time that we love our job. I think we have to give credit. That's why we end up become helping professions. Okay, But at the same time, we have challenge struggles with client or assistant to change client to assistant in this session. So maybe it'd be good to share your perspective, how
Yep.
was your experiment for you? How you
Yep.
dealing with this
Yeah,
client who assistant?
yeah.
Mm-hmm.
I think for me, what we were taught, right, in our course is that if clients doesn't want to make any changes, or clients doesn't seem like after coming for a session for like 5-6 times but doesn't seem to have any changes, we are taught that maybe it's just not the right time. They're not ready, or perhaps they've been asked by other people to come for the session. And I think at start, I do think that clients not ready. What I can do is just support them as best as I can. But I think over time I develop a new perspective that maybe their current situation benefits them a lot, or like brings some kind of advantage or some relief from them, that making the change might be a bit too difficult, or like making the change might be a little bit too unknown. So having that kind of perspective, it helps me to empathize with my clients a little bit more. So I don't have that kind of like blaming or a judgy kind of perspective. Oh, why you're not making any effort? Why you're not making any changes anymore? But perspective from the other perspective, if maybe their current situation give them a little bit more benefits than we actually can see. And this is how I go around clients who are maybe a bit more hesitant.
That was a very powerful sharing. Come
Yeah.
on, client readiness, right?
Yeah.
To be helped.
Yeah.
Sometimes we do face challenge that client. Maybe in the therapy session with us, but we do realize that client is not ready for make changes. But I like what you mentioned, that you do see the perspective that maybe that is the struggle they need to go through it.
Yeah.
And then we just have to respect that.
Yeah.
Thanks for sharing that. How about you, Celeste? Your experience?
I guess with hesitancy, I'll pause my sharing for a while, just to kind of mirror what you say, right? We recently learned of a word called congruence. So in this case, congruence in the context where when the clients struggle to make a change, when there's hesitancy, sometimes like what you say, the environment is maintaining that. Because in this case, their internal chaotic experience is congruent with the chaotic environment they're in. Yeah, so I find it quite interesting when you were sharing that. So it does, as going back to talking about self-doubt and competency and all that, right? I do feel like as and when we go along, as we once again learn from clients, right? How we look at clients' hesitancy, making, I guess, slower progress in the session, the angle is a bit different. How we see it is also quite different as well. Yeah.
I think it was very, very nice for you to addressing it sometime. We may see, because usually we just spend an hour with our client. And kind of like an hour, we do our very best to support our client. But like you mentioned about, sometimes clients have to face an environment that we do not know. The chaos they have to face and struggle. So it's not something to change that can just take place. So I agree with you as well. So we have to consider this aspect. I think here, for audience, I know sometimes making changes can be very, very challenging. I think for us, we are willing to journey with you as a therapist. But I think it's important to kind of like, it's also good to kind of like able to addressing it openly with your therapist. Where are you? Because sometimes that will give a sense how we can work with you. Sometimes I have a perspective, I'll have clients have a perspective that because they are not the expert, they're not able to tell what's going on. It's true in the way that we have training that are able to kind of help you out. At the same time, I really very much believe that you as a client, you as a resource person within yourself, know where are you. Sometimes open, transparent discussion with your therapist will be very helpful for your therapist, so they can work with you. So if you really feel that you need to take half a year, even 1 year, we're willing to work with you. But it's like, we just need to know how to go about to work with you. I think this aspect that we also want you to be able to consider. All right.
And I want to concur on that as well. That we may be the expert on theories, maybe the expert on emotions, thoughts, and things like that. But at the end of the day, you are the expert of your own life. You're the expert of your own inner experiences, and we can only do that much, I guess, if we don't know, the expert of their own things, right? So we'll hope that if you do have concerns about changing or like doing things differently, do have that conversation with your therapist. I think that will be very helpful, and maybe even bring like a next step into the therapy session, or maybe even bring your relationship with your therapy into the next step.
Yeah, very much support what you say. How do you Celeste? Anything you want to add regard to this aspect?
Like I feel like in this case, that's one of the reasons why, like in terms of sessions, they're usually very flexible things as well. And I guess when they come around, it's usually a main topic they like to talk about, right? No, let's just say they're dealing with stress or burnout in the most common situation, right? But however, I realize that as we go along with sessions, sometimes there will be things that's happening that needs to be addressed immediately. So I do have some clients who come in and it's like, Celeste, we are not going to go with the main thing. I need to firefight the situation first. So we'll talk about immediate skills that they require, right, to immediately address challenges that's affecting their mental well-being. And then we know that the main topic maybe is intergenerational trauma that they need to address, right? So I feel like in this way, being open and honest with your therapist, right, that's very helpful for the session. Because I could be talking about going on about intergenerational trauma in the session, continue our progress. But that session would feel like it's not addressing what's needed most for that time being.
Of course, I also needed to acknowledge that we here I think that's supportive of you being very honest. But I also know that how I cannot assume all therapists we have the same attitude that we have, you know. So I think I did mention as well, if you do find that after you try to be very open, you try to get support, and you don't feel this therapist that you're currently engaging is helping you, and you keep coming back to this struggle. So maybe you have to think about how the best of exploring option for yourself, because being stuck does not mean that the problem cannot be solved. So I think it's important to find a right therapist for yourself. I think that's something that we want you to also be, you know, don't give up. Because I think that's something very important. Okay. And that's very nice sharing. Really appreciate that.
Now that we're on this topic, right, I feel like yes, because once you know that you have a lot of cases, you know that sometimes when clients hesitant and then they come back the next few sessions and they tell like, actually the last 2 weeks I wasn't that engaged because this is happening. So sometimes they're not able to share at that moment as well, talking about client being honest. So sometimes it's hard to describe what's going on, right? And I'm so grateful that they came into the session, right? And then I guess that's where we trust in the process. Like therapy session is a long time thing from there.
I totally agree. Sometimes it takes time to be able to get client feeling comfortable too. But also it's interesting actually in a therapy where we also have different modality to able to engage client who find it very difficult to express themselves. For example, we do use expressive art, centering, drawing, painting, even some movement. It's part and parcel that we can actually use it to able to support. So do not be fear, you know, that how I'm going to talk to therapists if I can't speak. So sometimes the therapy will have certain method to able to engage you, to able to talk to you. Therefore, you don't feel like needed to struggle silence here. Okay, so we have addressed these two aspects just now. The first one is about therapy self-doubt. I think we actually discussed very thoroughly in terms of our personal encounter. We also talk about, you know, the hesitancy that we encounter with our client. So that is end of our part 1 summary. Thank you so much for watching. Wait for the next part.
See you.